seeing an increased number of people, or younger people especially, even below the ages of 30, who are getting fibroids. What is the major cause of fibroids? Is there like a common cause for this? And what are some of the signs and symptoms that can be detected, and so it can be treated early and on time?
Okay, to begin with, I would like to explain what really fibroids are. These are non-cancerous growths that occur within the wall of the womb or the uterus, so to speak. As I said, they are non-cancerous, and so most of them usually would not cause as much morbidity, but they can be symptomatic, and some of the symptoms that they can present with, especially if they're very large, is excessive bleeding during the monthly periods, infertility, because if they're very large, then they block the implantation of a fetus. So you find women with very large fibroids would suffer from infertility. As I said earlier, the bleeding can be so marked that the blood levels of the woman get so low that they actually need transfusion. You asked me about the causes. Now, most uterine fibroids, actually you will find there is a hereditary bit to it. You find if your mother or your sister, a first-degree female relative, has had uterine fibroids, then one is at a higher risk of also developing fibroids. Fibroids are usually under the effect of estrogen, which is usually a hormone produced in the ovary. So you find women who have started their monthly periods at an earlier age, earlier than 12, tend to be at a higher risk of developing uterine fibroids. Also, women who have not been pregnant have actually a higher risk also of getting fibroids. Now, as I had said, they are non-cancerous, so if they are not too large and they do not cause any symptoms, then there's what we call watchful waiting. You can just leave them well enough. If they're extremely symptomatic, then surgery can be done, and the surgeries vary from actually just taking out the fibroids themselves or taking out the whole uterus, especially if this is a woman has fulfilled her family size, does not want any more children. For women who've not yet had their children and they would like more, there are certain drugs that can be given to shrink the fibroids. Mostly women who are about to be menopausal, we actually advise them to just leave the fibroids if the symptoms are not too bad, because after menopause, when the estrogen levels go down, these fibroids tend to shrink by themselves.
All right, you talked about women who haven't given birth yet. What would you say is the prime age for women to start giving birth? Or is it even better to start giving birth earlier so that they can avoid fibroids or anything like that?
It's funny.
Is there a prime age?
It's funny you should ask that, because one of the risk factors of, for example, breast cancer, or one of the risk factors of ovarian cancer is not being pregnant or having children after the age, first pregnancy after the age of 30. So ideally, the best age, the ideal age to actually have, to have children would be in the 20s.